are just 14 rural hospitals in the Texas Panhandle. Many of them faced struggles before the coronavirus hit.
Now, in the early stages of this global pandemic, their issues are exasperated. KMR Local 4's Kaylee Green has the story in this special report.
As the number of COVID-19 cases continues to climb across the high plains, rural hospitals are feeling the effects.
Rural hospitals that are independent and vulnerable were hurting before the crisis, and the only thing that's happened in the last couple months is accelerate those challenges.
John Henderson, the president and CEO of the Texas Organization of Rural and Community Hospitals, or TORCH, says they've been busy trying to help.
Early stages were this intentional grinding to a halt of services and clearing out of hospitals and clinics in anticipation of needing to screen and test and treat patients. Then we went through this stage where we were worried about hospital closures. Now we're trying to gather supplies like masks and gloves and gowns.
Most of our hospitals say they're stocked up on personal protection equipment and have enough resources to keep treating the growing number of patients.
But we have enough PPE, we have enough bed capacity, we have a few vents. So far we've been able to handle it, yes.
But there are some gaps as the need grows.
We are in good shape with our PPE, with everything but gowns. And I think the disposable gowns, and I think everybody's kind of in the same boat there.
For many rural hospitals, there are not enough patients, up to 50% less, as they're putting off elective surgeries or other medical care.
Even our physical therapy department, a lot of their patients started canceling early on just to be safe, because the majority of your therapy patients are older patients.
As a result, the majority of hospitals are seeing huge revenue drop-offs.
We're applying for every grant, everything available to us at this point.
In our hardest-hit rural county, Moore County, their hospital CEO Jeff Turner says while hospitals' bottom lines are being affected already, the worst is yet to come.
We may not begin to really even see the true financial impact of this until July and August for most facilities. And of course, the longer that goes on, the worse that's going to be.
Rural hospitals are eligible for some help from the federal government.
That will help them get through another couple payroll cycles. But if we don't normalize pretty quick, we're going to have some rural hospital providers that are independent that'll go over the edge.
Lori Tamayo, the CEO of Dallam Hartley, says they're being proactive with their budget.
So in those areas that have those reductions, those 30 or 40% reductions in volumes, we are decreasing hours. We're not laying people off or anything, but we're decreasing hours. And that's mainly just because we don't want to get in a bad financial bind.
But not all rural hospitals face the same challenges.
We're part of a large corporation, Prime Healthcare. We have large buying power. We have large support from all of them, so we haven't run into any issues with supplies.
While there are many issues facing our rural hospitals, Henderson says there is a silver lining. We're seeing the importance of telemedicine.
We see that as a game-changing innovation when it comes to access to at least specialty care, but now maybe even primary care in those rural communities that have a small hospital, or maybe even more smaller remote frontier communities that don't have a clinic or even a physician. They're going to be able to connect to neighboring counties and clinics to provide care better than we ever have before. So there'll be good that comes out of this.
In Amarillo, Kaylee Green, KAMR Local 4 News.
Henderson says this is a tough way to be reminded that hospital and bed capacity and access to care really matter.
But he says he hopes this pandemic will be an opportunity to double down on efforts to support community hospitals. To see those full interviews with our local rural hospitals and John Henderson with TORCH, you can go to our website, myhighplains.com.